Good morning, afternoon, and evening. Welcome to our presentation on how information repertoire affects vaccine hesitancy, the processes of information verification and cognitive elaboration. I am Zhao from University of North Carolina at Chapel Hill. You can call me Eva. Here I am presenting our research on behalf of my collaborators, Zhexin, Sifan, and Lucinda. We know that vaccine hesitancy has been a long-standing problem, yet it's very much highlighted in the current COVID-19 pandemic. And research about COVID-19 vaccine in particular suggests that in the current media environment, the mainstream media, alternative media, and social media provide inconsistent or even contradictory content about COVID-19, disorienting people's beliefs and preventative behaviors. So this suggests needs to understand how a combination of channels, sources, and media affect people's vaccine hesitancy. So existing research show that COVID-19 vaccine hesitant people relied less on traditional and authoritative channels and sources, such as television, newspaper, and the government agencies. Instead, they rely more on social media for information. In the studying of the role of information acquisition in vaccine hesitancy, our key limitation is that they often assume that individuals primarily relied on a single or a few channels to obtain the information about COVID. For example, scholars usually ask participants to select one or up to 3 channels for COVID-19 information, and some other studies just analyze each information channel independently. We argue that it's important to address this limitation by applying a repertoire approach to information. So the repertoire approaches to information argue that the patterns individuals use to seek information has to be through a combination of sources, channels, and media because they are used simultaneously in order to serve unique needs and wants for particular groups of the audience. So the key research question we try to answer here in our research is that how does one's information repertoire affect vaccine hesitancy? In order to answer this research question, we review the literature and we come up with a theoretical framework. Here we theorize 1 direct effect and 2 indirect effects regarding the relationship between information repertoire and vaccine hesitancy. First, let's take a look at the direct effect, those constructs in the blue box here. As you can see, our research question 1 is about the effect of information repertoire on people's vaccine hesitancy. So when we talk about information repertoire, we are thinking about different sources such as CDC, Fox News, New York Times, and different channels such as interpersonal channels, phone calls, newspapers, or a particular social media platform, as well as the media outlets in terms of the mainstream and alternative media. And when we conceptualize vaccine hesitancy, following the literature, we are considering 2 aspects of vaccine hesitancy. One is people's lack of confidence in COVID vaccine, and the other is the perceived risk and the benefits of the COVID vaccine here. Further, we consider a mediation effect here between information repertoire and vaccine hesitancy through information verification. As you can see in this orange box here. So hypothesis 1, 2, 3 are related to this mediation effect. So information verification is an important concept to consider here. It means how information consumers verify the truthfulness of a piece of information, message, or claim. Our argument is that a more diverse information repertoire should be related to a higher level of information verification. So there are several reasons for that. For example, people who utilize a richer repertoire of information are probably also those who are more experienced and more likely to compare, evaluate, and reflect on the information that they acquire. So the other indirect effect we hypothesize here can be seen in the green boxes about cognitive elaboration and perceived information quality. So the literature suggests that when people encounter excessive information about a topic, their capacity to engage with information depends on cognitive elaboration. So our prediction here is that a more devised information repertoire is associated with higher cognitive elaboration. So one reason for that is that individuals who obtain information from multiple channels and sources are more likely to perceive high information relevance and importance, thereby enhancing their motivation to elaborate. And a higher level of cognitive elaboration elicits less bias processing and a higher accuracy motivation based on the selective exposure literature, as the current media ecology is filled with inconsistent information on COVID-19 and its vaccine. Thus, those people with a higher level of cognitive elaboration would have a higher accuracy motivation and is more likely to perceive this inconsistency of information in this reality. And eventually this perceived information inconsistency should increase vaccine hesitancy. And this is related to our hypothesis 4 to 7 here. So we collected a national sample of the US population in 2021. So the sample size here is 620. So we performed some analysis. Our results based on K-means clustering show that there are different groups of information consumers, and they did use a combination of channel sources and media in a different way, serving their own information needs. As you can see on the screen, we have a unique group of information consumers called traditionalists. And we'll take a look at the chart here. So here the blue bar just means the channel of television. And here these bars means authoritative sources such as a doctor, health professionals, local government agencies, and so on. And we can also see other groups of information consumers such as digital utilitarians. So they rely on a variety of digital platforms such as email, text message, blog, search engine, instant messages, and so on. And here is a really important group. It's called deliberative actives. So they acquire COVID information from many channels, sources, and media outlets. They use both the mainstream and alternative media here. And as you can see here, they even consume more information from alternative social media, which is the steep green bar here, and alternative news sites, which is the orange bar here. Okay, so this is like an empirical analysis of the patterns of information repertoire, and we are going to use these groups of people in our structural equation modeling in order to understand how information repertoire patterns are associated with vaccine hesitancy through the different mechanisms. So here is our results from structural equation modeling. We actually did several alternative models too. So for example, in one version of the alternative model, we just swapped information verification and information repertoire here because it's possible like the link points from verification to information repertoire as we use a survey study here. However, the model data feed of these alternative models were not very good, and this is why we will just focus on the results from our main SEM here. So the overall model data feed of this one is very good if you take a look at the CFI, SRMR, and RMSEA, etc. And most of our research hypotheses were supported, but we did find that the result varied a little bit based on the particular aspect of vaccine hesitancy here. So now let me just summarize 3 important pieces of results and discuss their implications here. So first, our results from the structural equation models show that information repertoire did explain much variance in vaccine hesitancy, ranging from 45 to 52%. So this is a large effect size. Our findings suggest that one, like people's information repertoire in terms of media outlets, channels, and sources is a key determinant of vaccine hesitancy in the pandemic, and scholars should consider a combination of channel sources and media in order to get a better understanding of the role of media on vaccine hesitancy. In particular, we find that deliberative actives, the group who use many channels and sources in order to acquire information, showed conscientious optimism in COVID vaccines as they reported the lowest lack of confidence in the vaccine and the highest perceived risk. And the second important finding here, those with a richer information repertoire verified COVID information more often and reported lower lack of confidence in COVID-19 vaccines. So deliberative actives were most likely to verify the information among the 4 groups, and higher information verification reduced the lack of confidence in the vaccine. So this suggests the need to enhance the literacy education regarding how people verify information, because this has important implications for addressing vaccine hesitancy. However, those groups with a richer information repertoire also experience greater cognitive elaboration, leading to a higher level of perceived information inconsistency and vaccine hesitancy. So this potentially suggests that higher elaboration does not necessarily produce desirable persuasive effects as based on the ELM literature. Rather, its effects depend on one's perception of the overall information quality, as well as one's personal information environment. As you know, there is this effect of echo chamber. So people's personal information environment and the level of consistency or inconsistency between the different pieces of information in their personal information environment matters a lot. So now let me end the presentation by talking about some takeaways. So first, the repertoire approach allows for more ecological understanding of information acquisition and its impact on vaccine acceptance in the current hybrid high choice information environment. So future research should employ repertoire approaches to deepen our understanding regarding how individuals process and respond to a multiplicity of information or misinformation. For instance, research can study how information repertoire patterns interact with individual traits, such as attitude and ambivalence, to shape vaccine-related beliefs or misbeliefs. And another important takeaway is regarding corrective information. So our study suggests that corrective information alone may not be enough to change public perception. As we know, a lot of misinformation and corrective information research currently conducted use experiment, and they show very promising effect of corrective information. However, we know people have to live in this personal information environment. And this is why we need to consider a combination of channel sources and the messages here. And we have to be aware that people's exposure to inconsistent messages can trigger vaccine hesitancy. So it's really important to design and distribute corrective information with the understanding that people will receive this piece of corrective information like simultaneously with other information or even misinformation. Okay, thank you very much. If you have any questions, feel free to leave a comment or email me at ezhao@unc.edu. Thank you.